Hello everyone, I'm Dennis, and today I'm going to talk about virtual reality and exposure therapy. I will first explain what exposure therapy is, and then I will give you some cases and examples of how well and how VR and exposure therapy work combined together. So first, I'll explain what exposure therapy is. Exposure therapy targets behaviors that people engaging in response to situations or thoughts or memories that are viewed as frightening or anxiety-provoking. And the goal of exposure therapy is to help reduce a person's fear and anxiety with the ultimate goal of eliminating avoidance behavior and increasing quality of life for those patients. Since that if the sickness is not addressed, the avoidance behavior can become more and more extreme and interfere with a person's quality of life. As a person avoids certain situations and thoughts and emotions, they don't have the opportunity to learn those things. Those situations may not be quite as dangerous or threatening as they seem. So avoidance also interferes with a person working through those thoughts and memories or emotions. Now, for exposure therapy to be effective, it's very important that a person confronts a situation that closely maps onto what they fear most, and which actually is what virtual reality does. So then I'll start to give you some examples. Yes. The first example will be acrophobia, which is meaning that a person is afraid of height. Yes, as Dr. Phillips had said in the previous class, actually more people are afraid of heights than we thought. It only shows up when we're in that situation. And when people get afraid of heights, they'll get shocked and they'll get so frightened that they can't even move their legs. So what a pity. Yeah, so with VR and exposure therapy, what it does is just bringing you to that place, like Dr. Phillips told us, taking you to a high building and letting you to walk on a very narrow way. And when you conquer the fear, it would actually be quite amazing experience for you. Yeah. And yeah, that's the first example. And for the second example, it would be kids, especially kids with autism, because it would be quite a challenging task for them to learn in school. Since they have autism, they have this obstacle talking and interacting with other classmates. So with the help of VR, it actually allows them to get comfortable and get used to the environment in the society that they're about to face. And with the help of VR combining with exposure therapy, some kids actually their autism really didn't show up anymore. So it just shows how overwhelmingly great exposure therapy combining with virtual reality works. And now for the third example, it would be eating disorders and body dysmorphia, which is just disorder of taking foods and eating, yes, which is, very apparently bad for your health. And now how it works doesn't seem as obvious as the previous examples, since what VR does in this certain situation is to include showing patients the implications of reaching their desired weight and comparing their actual body shape to an avatar, creating using their perceived body size and altering a virtual reflection to match their actual body size. And by doing so, scientists believe that it does help dealing with eating disorders and body dysmorphia. And now for the detailed example, it would be how PTSD is cured by the combination of VR and exposure therapy. Well, there's a software developed by the U.S. Army Simulation and Training Technology Center, which is called Brave Mind. And in this software, there are some virtual reality worlds which can bring soldiers back to those situations. And one of them is called Virtual Iraq, which is a program that they launched all the way back in 2007 to help the veterans returning from the Middle East dealing with the traumas of war. And the soldiers that have received the treatment, they'll be asked to wear a head-mounted display, which is a VR headset, and they're virtually transported to the streets of Iraq. By the end of the course of therapy, physical elements such as vibration and even smells of smoke and dust have been added into the equation. So the patients are even given a mock rifle to hold to complete the illusion. And Virtual Iraq has allowed numerous veterans to process their experience overseas, sleep without medication, and reduce episodes of anxiety and panic, since they have conquered those frightening memories and emotions. This is the end of my video, and the resources are from the Virtual Reality Pain Reduction Project of University of Washington, Seattle at UW Harborview Burn Center. And other resources are PHOBOS Anxiety Management Virtual Reality Platform, and a few papers from Dr. Matthew Till, actually. So this is the end of the video, and I hope you enjoy it.